Hi, my name is Dr. Dave Elwell, and I'd like to welcome you to this video series that I'm putting out on tips on how to best take advantage of your visits with any healthcare provider. And as an emergency room physician for more than 20 years, I see that people could really benefit from these health tips. If they implement them, they'll be able to get the most out of that visit, the most value, and the most results. And what I'd like to talk about right now is something that's very simple but isn't commonly understood, and that is why you need a primary care provider. And the basic reason is that even, what I will hear from people, and I'll ask them, well, who's your primary care provider, so that I can arrange follow-up or understand their health history, and they'll say, well, the good news is I've never needed one. And my response is, well, right now you need one, and it would have been more helpful if you had already had one. And I'll give you an example. It's a kind of a dramatic example, but it was quite a few years ago when a woman came driving up to the emergency room door, and in the car, in the passenger seat, was her husband. And she came running around and said, you got to help my husband, you got to help my husband. We went out, and the nurses, and we got him out, and the whole time that we were getting him out of the car, he was arguing about why he didn't need to be there. He's never needed a primary care physician. He's never been to a hospital before, and he doesn't need to be there now. But my wife dragged me here. We got him in the wheelchair. We got him into the room as I'm talking to him about the chest pain that he had complained to his wife. He was in the middle of a sentence saying, I've never had a family doc, I've never needed one, and boom, he was gone. And he died right there. He went into ventricular fibrillation, and the good part of the story is that he was right there, thanks to his wife, and we were able to resuscitate him, and he was able to get his heart attack fixed, and he ended up doing quite well. But the point of that story is that at the time that you get sick is not the time to have a primary care provider. What does a primary care provider offer? First of all, they know you. They know the things that are important to you. They know the things that you value. And there's always these value issues that come up with healthcare interactions. Some people don't like to take medications. Some people do. Some people need help with their encouragement on prevention, and some people don't. And you'll develop a relationship with a primary care provider even if you don't have any acute health care issues. If you think about it, most of us have at least one or two acute health care issues that we could use some advice on every year. And the time to unload those on someone is not when you have an acute, emergent, or more urgent health care issue. So I would recommend that anybody who can do it and has the means to do it, have a primary care provider. See them on a semi-regular basis. Doesn't even have to be every year. Get connected so that when you do have health care issues, you have a place to go to. An emergency room has a place for you to follow up with. And I think that you'll find that you will get information from them that will lead you to better health, either by inspiring you to be healthier or watching for development of high blood pressure. In fact, that particular patient that I talked about, turned out he probably had very high blood pressure for many years. Prior to that, he had high cholesterol, and none of that had been picked up because he had never accessed the system. So this is a health tip and a series of tips about seeing your healthcare provider. Right now you can find them on YouTube, but soon there's a website called VitaPillars.com that's going to be coming out, and these will be included in the VitaTips portion of that website, and you'll be able to visit those and pick up lots of information. I appreciate you coming and listening to this, and this is Dr. Dave Elwell wishing you health and happiness.